clinics for years, for decades. But is there something different about planning clinics for the novel H1N1 virus as opposed to our usual seasonal vaccines?
Well, yeah, as you've heard, the populations that H1N1 is affecting are different.
Okay.
So the populations that we're targeting for vaccination are very different than our traditional senior population for the seasonal flu.
Okay.
Which is why we're spending a lot of time and effort on collaborating with the schools where that population most exists. So we're working closely with the schools, with the administration, with the school nurses to implement clinics that are located at the schools and using their facilities and staff to make sure that they get the vaccine out to the target population.
Right. Now, will those clinics be, do you anticipate those being open only to the students at that particular school, or inviting the general public, you know, as appropriate within the target areas, to attend those? Is that finalized?
That's likely. It's not finalized in most cases, and I think it's likely to vary depending on the municipality and the jurisdiction.
Okay.
Some of the schools may do school clinics during the school day where they're targeting just the school population.
Right. Okay.
I think that most will probably do clinics that are after the school day, either in the evenings, late afternoon, or on weekends. And many of those will be general public clinics, but still targeted at the target population, so school-age children primarily, maybe pregnant women and some of the other target priority groups.
Okay. Now, are you finding there are particular challenges in planning this sort of, you know, different type of flu clinic?
I think the biggest challenge is all of the unknowns. You mentioned, and rightly so, that vaccine is starting to be delivered, but we don't know how much is going to be delivered and when it's going to be delivered, and what type of vaccine, because there are different formulations of the vaccine. So those questions are still there, while we anticipate that the clinics will hopefully start in the near future, probably, you know, getting really up to steam in November. That could change. Things are changing all the time. So. And the availability of vaccine is key with that. So that's one of the challenges. The other challenge is how much people are really going to want the vaccine, because it is a voluntary program. So there's an unknown as to how many people are really going to take advantage of the availability of the vaccine. And then just the potential sheer numbers, whereas, you know, our health department typically provides maybe 500 to 700 doses of vaccine per year to the senior population, because most now go to their private physicians or other providers. We may see a huge increase possibly in the numbers of individuals we're vaccinating. So that's coordination of those clinics.
Well, I think it sounds like the unknown factors are what make it the most difficult. More than anything.
And every day we learn something more, so hopefully we're getting closer and closer.
This is always an evolving. And you mentioned not knowing the exact formulations yet in terms of how the vaccine will be delivered. And I wonder, Somni, if we can come back to you for a minute. When this vaccine is administered, is it done in the same way as the seasonal the seasonal flu vaccines, or is it administered differently in any way?
The formulations for the novel H1N1 vaccine are very much the same as you would see in your seasonal flu vaccine. The main difference is that this has one strain. So this vaccine will be available in shot form as also in the flu mist. So those two, the flu mist will be a live vaccine, and in the terms of the shot will be an inactivated virus.
Now, are clinics, and maybe there is no hard, fast answer to this, but are some flu clinics, will they be offering both vaccine? Is that allowed? Can you give both seasonal and H1N1 in different arms during a flu clinic, or do they have to be done separately?
At this time, we have already started our seasonal flu clinics, and we'll be continuing towards the end of October. If there is a possibility to have them at the same time, it'd probably be best you seek your medical provider, but you would be able to get both the shots at the same time. But again, you should see your physician to verify that information. But the reasoning, and a lot of health departments were doing the seasonal vaccine early, was because we were anticipating to get the novel H1N1 towards the end of the fall. So at this time, we were looking to do the H1N1 towards the end of October. So some may coincide, but as of right now, we probably will be doing them separately.
Now, I should mention that, Kevin, the towns served by the Middlebrook Health Commission, several are in Somerset County, one is in Middlesex County, Somni being from Middlesex County. but it sounds as though the clinics in each of those areas are generally intended to run fairly similarly. Is that correct, Kevin? You're also doing your seasonal flu clinics earlier this year so that you can focus on H1N1?
Yeah, our seasonal flu clinics are just about done, actually. So, we're switching over our focus to the H1N1. But I think it's important to note that the H1N1 vaccine is being provided by the federal government. And so one of the longstanding restrictions of residency in some areas with the seasonal vaccine does not apply with the H1N1.
So Somerset residents can go to Middlesex, you could go
or anywhere in the country.
Else.
Right, because it's being provided by the federal government, there are no restrictions on residency. The only restrictions are the priority groups.
All right. Now, is there a cost to the vaccine? Will the public need to pay when they go to these clinics?
Not to the public clinics.
Not to the public clinics.
Clinics run by the health departments, then there's no fee. There may be a co-pay or administration fee in private offices, depending on those private providers. But not for the vaccine. The vaccine is being provided for free to everyone. Okay.
And my understanding was that insurance companies were also, in that private sector, they were also covering those expenses as well, as something I just read recently. Kevin, do you have a sense of your anticipated schedule? I mean, when you say you'll be starting maybe later October, early November, how long what is the extended period of time that you think these vaccines will be available? Maybe, I don't know if you have different answers for that in the different counties, but.
The one thing we anticipate is that the vaccine from the federal government will be delivered over a long period of time, probably months. So we are planning on our clinics extending over a long period of time. So while we may begin late October, early November, we would expect that those clinics would continue to be offered through the winter months, maybe even into the spring, just because of the need to vaccinate as much of the population that wants it and the availability of the vaccine.
Okay. And is that the same? And I assume this is the case statewide, nationwide, that they will just continue as long as needed?
Absolutely. As long as there's a need and there will be enough vaccine, we'll be able to provide them. So it's kind of hard to say because we don't have the vaccine in our hand. And as Kevin had mentioned, we don't know how much we're getting in one shipment. But there will be enough vaccine. Okay.
Now, Kevin, you mentioned that the vaccine is voluntary, and certainly no one you can't require someone to receive it here in New Jersey. In the absence of someone choosing to receive the vaccine, and not that it should be instead of, but there are certainly precautions that we always encourage people to take to help prevent illnesses of all sorts, respiratory illnesses. Something, can you speak to that and some things people can do to just reduce their risk of infection?
Absolutely. If you are currently experiencing symptoms or when you do feel sick, we recommend that you stay at home, and that goes for school-age children. Whether you're working or unemployed, you want to limit your interaction with those around you because you want to prevent spreading the illness for your health as well as someone else that you may encounter. Secondly is when you're coughing or sneezing, you want to try and cough into your arm, into your shoulder, versus coughing into your hand and then touching another object and spreading the virus that way. Try and stay healthy. We recommend that, if you aren't able to always wash your hands as often as possible, you are able to use the alcohol gels, and sometimes it's convenient to have it in your purse or your car, or even at your desk if you're not able to get to that frequently. But you want to limit, as much of the virus as possible in terms of contact.
Kevin, because you've both indicated that the target group is different, so one of the differences in these flu clinics that will be offered at through the public health agencies is that more children, obviously, are the target audience. Pregnant women who have not been a target audience before so routinely in public health clinics. So my guess is that the populations that will be attending may not have normally participated in public health flu clinics before. So for those who have not, what would those folks be, what can they expect when they attend a community clinic?
Well, you're very right. And I think that, what we would ask first is that everybody who's attending the public clinics understand all the variables that we're dealing with and to be patient with us. As I said before, typically we do 500, maybe 700 doses in my service area of seasonal flu, and those are individuals who have been coming to our flu clinics for years. So they're familiar with our process.